stethoscope? You guys have your own stethoscope?
Yes,
Yes,
doctor.
doctor.
Okay, all right. So perhaps I'm not sure if you have dogs. I think you can actually practice doing physical examination. Okay, just assume that your dog's is small ruminants, a goat or a sheep. You can do that. A cat would be a bit small for to be considered as goats or sheep. But if you can actually practice on a pillow, maybe, all right, on a pillow, because in ruminants, I've actually mentioned this last week, that they have a development and everything. So you need to practice on that. Okay, so if you can just practice on your pillow or anything. Okay, and for you to practice auscultation, you can use your stethoscope. You have your pets, you can use your pets, because the technique will be just the same among different species. What else? So I'm not sure, in small animal, do you guys perform percussion and auscultation? But you can do that as a practice. Yeah, but the different techniques that is always what do you call that, being done on ruminants would be development, the percussion and auscultation, and also the succussion. Okay, so I'll just share the screen. Okay, so I hope that you guys will are able to actually access the Google folder. Okay, Google folder, because I've actually put everything inside that Google folder. So I just shared with your class Gmail. Okay, your class Gmail. However, if you wish to use your own Gmail, you need an access. So I think I've actually granted an access for one of you last night. Okay, so if you wish to use your own Gmail account, you may do so, but I just need to grant you an access. That's all. I will receive an email, and then I'll just approve the access. You can do that. All right. So last week. We've talked about the different techniques of physical examination, and we've talked about the distant observation, different techniques of physical examination, and what to perform, like step by step, the general physical examination. But for today's session, hold on, I'm just going to record this. Okay, record. You should be able to see my screen. All right.
Yes, doctor.
I'm just going to turn off this WebEx can be very heavy. Okay. So we'll skip this one. Okay, so just imagine that you have a cow in a crush, or a goat in a crush. Being restrained properly. And then what you need to do is that to start off doing physical examination in a properly restrained animal, so you can actually start at the back of the animal. Okay, so you can start at the back of the animal, because you can do different things while you are at the back of the animal. Okay, so just assume that you have finished doing the distant observation, the general inspection and everything. So you stand at the back of the cow or the animal, and you have to assess the symmetry, the symmetry of the abdomen, the symmetry of the what do we call that, the legs and everything, the mammary gland in the cow, and then you can take your thermometer. Okay, we used to have this mercury based thermometer. Okay, but it is it's not allowed anymore to use the mercury-based thermometer. So you can actually purchase any digital thermometer in any pharmacies. So you can use that. If I mean in a hospital setting, of course you have, or in a clinic you have this lubricant, okay, KY jelly. But in a farm, sometimes you don't have those kind of things. Okay, you sometimes you forget to bring your own KY jelly. So you can actually use, in a farm setting, you can actually use water to lubricate the tip of the thermometer, or you can use a pieces just to make sure that it's moistened a bit at the tip of the thermometer. All right, and then you take off the lid, the cover, and then you can just insert. I think you have to turn on first the digital thermometer, and then you can insert rectally, okay, into the rectum. Don't get confused with the vulva, okay. So you have to make sure that it is being inserted in the rectum, and make sure the tip of the thermometer touches the rectal wall. All right, so you can just wait for a few minutes. If you use the mercury-based thermometer, you would need to you would need to wait, I think, around 1 to 2 minutes. Okay, so it's a bit longer if you use the mercury-based thermometer. But if it's digital, you just wait for the beep of the thermometer, and then you take out, and then you can just take the reading. Okay. For the mercury, I don't have any video on using this mercury-based thermometer. But if you use mercury-based thermometer, you need to flick the thermometer so that the mercury level will actually falls below the reading. Okay, the lowest reading is actually 35. So make sure that you flick the thermometer and make sure the mercury level will be fall below 35. So that is for the mercury. But if you use digital, of course, it's much more simple. Okay, it's much more easier. And then you just take the reading. Okay, so this, I mean, you are needed to memorize for all species, I assume. Okay, it's okay if you cannot remember everything, okay, because you have to deal with many species of animals, but you should know where to look for the reference. Okay, you can use milk manual, okay, or if you can actually memorize the value, the normal temperature, the normal pulse rate, the normal heart rate, the normal respiration rate. So you have to memorize that. Okay. So this would be the normal temperature for each of the ruminant species. Okay. So if it's within the normal range, so you can just assume that it's within normal range of temperature. But if it's higher, you can call it as hyperthermia or fever and hypothermia. So what is the difference between hyperthermia and fever? What do you guys think?
Fever is due to infection, doctor.
Okay. What about hypothermia?
Maybe due to temperature of surrounding.
But while taking the temperature, for example, like you're doing this one in the picture here, so how can you actually say that the animal is having fever or hypothermia?
We might need to observe also other clinical signs, doctor.
Yes, correct. So if it's accompanied by other clinical signs, perhaps like some degree of inflammation, so you can actually say that the animal is having fever. Because the surrounding temperature, the environmental temperature may also affect the body temperature. So hypothermia is just a basic increase in the body temperature. Okay, so hypothermia means reduced body temperature. Okay, which can happen if the animal is having shock. Yeah, so most of the time it can happen in shock or but mostly most of the diseases would be or infectious diseases would be fever, increase in the temperature. Okay. So okay, this is pulse rate, which can be taken at the middle coccygeal or the facial arteries in the cattle, but for the small ruminants, you can take it from the femoral artery. So pulse rate is a bit difficult because you need to feel for the bounding pulse of these arteries. So sometimes you may not be able to feel for the bounding pulse. So it's okay if you can just proceed by auscultating the heart and take the heart rate. Okay, because normally the pulse rate would be the same as the heart rate. Okay, but I mean, it may or may not tell you. I mean, whether the disease, there's actually presence of heart diseases, for example. Okay, so if the pulse rate is reduced, it is called as bradycardia. If it's increased, it is called as tachycardia. Okay, so perhaps while taking the the pulse rate, you can actually determine the rhythm and amplitude. But we don't actually really look into the rhythm and amplitude of the pulse in ruminants. Okay, so this is the normal range for each of the species. Okay, so this is how you should take the pulse rate from the coccygeal artery, and this is the location of the facial arteries in cattle. All right. This video just to show you like how to open up the mouth in a cattle. Okay. So you just stand by the side of the animal, grab using one hand, grab the muzzle. Okay, at the commissure of the mouth, and then the other hand you can actually pull out the tongue. Okay. All right, so you can actually look for the dentition, the aging of the cattle by looking at the teeth, if there's any oral lesion, etc., something wrong with the tongue, so you can actually do that. Okay, this is just to show you the location of the submandibular lymph node. Okay, so it will be just below the mandible. This is the mandible, so this will be the location of the submandibular lymph node. Okay, this is a video of palpation of the prescapular lymph node. Okay, so this is actually the scapula of the animal. So you just slide through 4 fingers or the whole hand just in front of the scapula. So that this is why it is called as prescapular, because pre means that in front of the scapula. Okay. And then this is the palpation of the prefemoral. So this is the femur of the cattle. So just use your fingers and slide through just in front of the femur. Okay. So this is again the location of the lymph node is actually just in front of the femur. So that's why it's called as the prefemoral. So the state of hydration is another important thing that you should perform while doing the physical examination, okay, to look if the animal is being dehydrated or not. So it is based on the elasticity. Sometimes we call it as a skin turgor or the skin tan. Okay, so just pinch a bit of the skin. If the animal is hydrated, so it should return within 1 to 2 seconds. Okay, if it's prolonged, then you can actually say that the animal is dehydrated. You can also inspect the eyes, okay, the anophthalmos or the sunkenness of the eye, and you can also check the mucous membrane, which is actually the gum area, okay, or vulva. So if it's tacky means if it's sticky, then you can actually say that the animal is dehydrated. But other than that, you can also determine the state of you can actually assess the dehydration of the animal based on the depression level. If the animal is depressed, you can also say that the animal might be dehydrated. Or second, based on the heart rate. Okay, so if the animal is having like tachycardia, you can also say that the animal might be dehydrated. Okay, so this is just to show you the skin tan, which is the first one is actually at the neck area, and you can also do skin tanting at the upper eyelid. Okay, like this one. So just observe like how long will it return to its normal position. So if the animal is not dehydrated, so within like 1 to 2 seconds. All right, so this is the thorax. Okay, so after you've done your palpation of the lymph node, you can actually use your stethoscope and you can actually auscultate for the heart, to listen for the heart sound, to detect if there's any heart murmurs, if there's any abnormalities in terms of the heart sounds, and for you to take the heart rate. Okay, so usually the best place to listen for the heart sound is actually on the left side of the animal. Okay, so this is just to show you like the landmark. Okay, how many ribs does a cow have? How many ribs? Anyone? Mira Razlan?
26. 13
Sorry?
pairs of ribs. 13 pairs.
Yes, 13 ribs. Yes. Okay, 13 ribs. So meaning that you have to count from the back, the last rib, and then you have to determine like within the fourth and the fifth intercostal spaces. So that would be the best location to hear, to listen for the heart sound. Okay, so the first, you should know by now that the heart sound should be lap dap pause, lap dap pause. So the first sound is actually the systolic sound, okay, which can be heard over the cardiac apex. I hope you should be able to differentiate where's actually the cardiac apex, where's the cardiac base. But I'll refer to the next picture. So diastolic. So second sound dub is actually the diastolic. Okay, the second sound is actually the diastolic. So this can be heard at the cardiac base. Okay, so if you are saying that the apex should be down here. Okay, so the base should be up here. The base of the heart, the apex of the heart. So if you were to listen for the tricuspid valve, the mitral valve and everything, so that's actually the indication where you can actually place your stethoscope. Okay, so between the shoulder and elbow at the third intercostal space, and then below the between the fifth intercostal space. So this is actually the left side of the of the animal to listen for the heart sound. Okay, so this is just roughly to show you. So basically, I mean, we'll go through the video later. So basically, you have the elbow, the point of elbow. So you just place your stethoscope behind the point of elbow. Okay. I would not be. I mean, we'll just skip this. Okay. So if the heart sound is muffled, so you can actually say that they might be having pericardial effusion or even the pleural effusion. So if there's heart murmur, so it can be anything, any lesion at the endocardium, okay? And this is actually the normal heart rate for ruminants, around 60 to 80, and then in calves, usually it would be higher than that. All right, and then you use your stethoscope after you listen to the heart sound, you can actually listen to the lung sound, okay? So this would be the area where you can actually listen for the lung sound. So meaning that you can move around your stethoscope around this area. Okay. We've gone through here. It's okay. So just to show you, this is actually the left paralama fossa. So you'll be standing at the left paralama fossa. So in ruminants, you have to do many things on the left side. So, but it doesn't mean that on the right side you don't have to do anything. So you still have to auscultate the heart on the right side as well. It's just that the sound might not be clear as on the left side, but you still need to hear the heart sound from the right side. Okay, so this is just to show the location in ruminants, very important organ, which is rumen, which is actually located at the left paralama fossa. Okay, so the normal rumen sound would be around 1 to 2 contractions or sound per minute. Okay, so you use your stethoscope, place your stethoscope on the left paralama fossa and just wait for a minute to listen for the rumen sound. Okay, so if it's increased in the sound, you can say that the animal is having hypermotility. Okay, or if it's reduced, you don't, or if there's no sound at all, you can actually say that the animal is having hypomotility. Okay, so this is just the landmark, the location. So this is the hind limb. Okay, left paralama fossa. So you can just place your stethoscope here. Okay, and this second picture shows the ballotment, the act of ballotment. I mean, you can actually place your fist, two fists, on the left paralama fossa just to feel for the contraction. But sometimes you just miss that. It will be very hard for you just to the rumen contraction just by placing your fist like this. Okay, if you have your stethoscope, by all means you have to use your stethoscope and listen for the rumen contraction. So this video shows you how to do ballotment. Okay, again at the left paralama fossa, so you just use your fist, two fists, two hands, and just push through, because you would like to feel the rumen coming back, because you push it into the abdominal cavity, and then it will bounce back. The rumen will be able to bounce back. So this is just to determine the consistency of the rumen. So you have to perform from up the upper area until the the lower area here. Okay, just to determine the consistency. What about this one? I think this is just to show you the what we call that, the rumen contraction. So if you were to detect the rumen contraction, how does it sound like? It should be, some people call it like a washing machine sound. Okay, like a gurgling sound, fluid gurgling sound. Okay, but some people just call it as a washing machine sound because it rumbles. Okay, so you have to hear it for over a minute in order for you to detect that kind of sound. Okay. Another technique is actually the percussion and auscultation. So these would be the area to auscultate and percuss at the same time. Okay. If you suspect LDA, left displaced abomasum, so you should be able to hear for the ping sound at this area here. Okay. Ping sound. Okay. How does it sound like? It's like just imagine that you have like a empty can and you put like a maybe coin something, okay, or stone inside that empty can. So that is actually how ping sound should sounded like. Okay. Okay, this is actually how you do auscultation and percussion. So auscultation, because you use your stethoscope. This act here is called percussion. Okay. That is why it is called as percussion and auscultation. So don't get confused because there's actually an act of percussion only. So if you do percussion, you don't need to use your stethoscope. But this one here is actually the percussion and auscultation. So please be aware of the area. Okay, so this person here is starting at the left paramba fossa and then it will be go down a bit. Okay. So basically you are going to percuss around the area of the stethoscope here so that any sound will be transferred into the stethoscope so you can actually hear it. Okay. So this is actually the location of where you should be able to hear for the ping sound. Okay, you have the wing of ilium here and then you have the elbow here. So this is actually where you have to do your percussion and auscultation. Some books will refer it at between the 9 ribs up to 12 ribs. So it's actually around this area. Okay. You can actually do auscultation and percussion on the right side of the animal, okay, to detect the presence of right displaced abomasum. Okay. This is on the right side of the animal, whereby this person here is doing the auscultation. Okay, and also for the on the right side of the animal, you have to do the palpation of the liver. So basically, this is actually the last rib on the right side. So you just have to use your hands and feel if the liver is enlarged. Okay, so basically, while palpating, if it's normal, you don't actually feel anything. But if it's enlarged, you can actually feel the some kind of a bulging just behind the last rib here. Okay, this one, right, miscellaneous. This one is actually, this is called as a Wheater's test. Okay, in a cow, they have this condition called the TRP, hardware disease, traumatic reticulopericarditis, whereby it's a very painful condition. So if this is actually one of the tests called as a Wheater's test, just to detect if the animal is having any pain. Okay, because in TRP, the animal will feel pain at the lower thoracic area here. Okay. This just to show you, like, you have to look for the skin. Don't forget the dorsum of the animal because most of the ectoparasites like mites, lice, they tend to affect at the dorsum. Okay, at the top body of the animal. Okay, so in young ones, in calves, in kids, so you have to check at the ventral abdomen. If there's any umbilical hernia, if there's any navel ill, so you have to check this area here. Okay, so this one is actually the aging in the cattle by dentition. You should be able to age a cattle Okay, we'll go through sheep and goats later, but this one is for cattle. So by aging the cattle using their teeth is actually just based on the incisors here. So you don't have to look at the molars or premolars. Okay, so just focus on the incisors. So in ruminants, they don't have the upper teeth, so they just have the hard dental pad on the upper jaw, like this one here. Okay, so this is in a young calf whereby they have this temporary incisor. Okay, so they have a special names for each of these incisor. Okay, so if it's a central pair, it is called as pinchers, and then the second pair would be called as the first intermediate pair, and then the third one is called as the second, and then the outer pair called as corners. Okay, they have a special names for that. So this one here is you may refer to this if you get a chance to actually examine a cattle mouth, a cattle mouth, and try to age the cattle. Okay, so you have this guide here. Okay, so basically, this is actually not so much different as in the sheep and goats. Okay, so at birth they have this temporary incisor. Okay, and then if it's around 2 years old, they have central pair is actually the temporary one, okay, or called as the pinchers. So at 2 years old at least, so this is being replaced by a permanent incisor. Okay, so it should be bigger than the temporary incisor. So if it's calf, so you can actually say that the incisors are a bit smaller. So when they grow older, so it will be replaced by the permanent incisor, which should be bigger than the temporary incisor. Okay. All right. I will actually show you. Okay. Aging for sheep and goats. Okay. This one here. For sheep and goats is basically easy. If you were to age a cattle, you need to have the cattle being properly restrained. Because if you have you've seen the video, it's quite hard for anyone to actually be able to open up the mouth of a cattle. But if it's for sheep and goats, they are smaller than cattle, of course. So you should be able to age. Okay, so if you get a chance to examine a sheep or goats, so just look at the teeth and try to age the sheep and goats. So basically, they have some similar type of teeth like cattle. They have incisors called as a central incisor. So they have a second pair called as incisor one, a second incisor, and then they have the third, and then they have the fourth. Okay, so basically, this is like a 1 year old sheep. So they have like one pair of permanent incisors. Okay, so how to differentiate? Of course, the permanent incisor should be bigger than the temporary incisor, like this one here. Okay, so this one here is actually 1 year old, and then if they have two pairs of permanent incisors, basically this animal is 2 years old. So it's quite easy. One pair, 1 year old, two pairs, 2 years old. Okay. This is 4 years old sheep because you can actually see four permanent incisor, one pair, second pair, third and fourth. Okay. So this is actually a bit around 6 to 8 years old of sheep. So as the animal grew older, so you can actually see that there's actually the gap spacing between these teeth here. Okay, and this one here, like one of the this is actually extremely aged sheep. Okay, so this has a severely worn or missing teeth. So you can actually say that this animal is quite old. All right. So this is how you actually age the sheep and goat. Okay. We will go through today's physical examination, the one that we record on our own. Okay. Okay, so basically, I'll just go through again now. Okay, basically between small ruminants and large ruminants, it will be just the same. The principle is just the same. You can always start at the back, right? So this one is actually the distant observation, okay? All right. So make sure that the animal is properly restrained. You need like for sheep and goats, you usually need like one person. Or if it's a bit hard if you were to restrain and you were to perform the physical examination. So basically, you just need two people, one for restrain, and then one will be the one who is going to perform the physical examination. So you just start at the back of the animal, okay? For example, like this one here, before the first step, not the first step, the hold on. Okay, so after you've done your distant observation, okay, get someone to restrain the sheep or goat, all right, and then start at the back. Okay, you just need to prepare your thermometer. Okay, And while you are at the back of the animal, okay, if the animal is female, you can always check for the vulva. So that's another way to look for to examine the mucous membrane. So for the mucous membrane or the vulva, you have to check for the color. All right. Why is it stuck here? So you have to check for the color. You have to what else? The color should be, if it's normal, pink or pale pink. Pale pink is actually normal. Is usually normal color. If it's turned into bluish in color, you call it as cyanotic. If it's turned into yellowish in color, you say it as a jaundice. Okay. So I mean it depends. Okay. After you check for the color, okay, for example like this one here, okay, so you check for the color. This is a female, is a doe. So you check the color. So this one is normal, which is pink in color. Okay, so after you've checked your color, you have to check for the CRT or capillary refill time. So just to pinch and let it out. Okay, so if it's normal, usually it will return to its normal color within like 1 to 2 seconds. Right? If it's prolonged, so you can actually say that CRT is longer than is longer, perhaps 3 seconds CRT, 4 seconds CRT, or 5 seconds CRT. Okay. Sekejap. Okay, so start. Apa? And then after you check for the CRT, you take the thermometer and take the temperature of the animal. Okay, if it's male, so I mean they don't have vulva, so you don't have to check lah. Okay, so just take for the uh, temperature. Okay. Step 1, and then check for the mucous membrane, the vulva. Okay, and then you take the temperature. Okay, use this. This is an example of digital thermometer. So usually you just put like a lubricant, a bit of lubricant at the tip here. Okay, insert per rectally. Make sure that it touches the rectal wall. Okay, just make sure that it actually turns on. Okay, so after you've taken your temperature, so you can just move to the left side of the animal and palpate for the pre-femoral lymph node. Okay, and then identify the left paralung fossa, use your stethoscope and listen for the rumen sound. So Dr. Loman here is actually doing the auscultation and percussion. Okay, it can be done, I mean it's a similar technique between small and large ruminant. Okay, and then you move to the thoracic area on the left side, listen for the heart sound, for the lung sound, sorry. Okay, so just make sure that there should be one person here restraining the animal because the animal moves. Okay, and then just behind the elbow, the point of the elbow, put your stethoscope here to listen for the heart sound. And then moving on, you can just palpate the pre-scapular lymph node. Okay, at the same time, you can do skin tenting. Okay, and just palpate the neck area. Okay, so basically you move from the back, left side to the front of the animal. Okay, so this is actually to palpate the submandibular lymph node. So it should be in pair. Okay, check for the face, the face area. So the eye, this is actually another way to look for the mucous membrane, the conjunctiva, the color, okay, the gum. Just pinch and look for the CRT. Okay, and then you move to the right side of the animal, palpate the same thing. Palpate the pre-scapular, listen for the lung sound, listen for the heart sound, and then you can auscultate the right side of the abdomen. Okay, this is especially important for cattle. Okay, if they have like a gas distension in the intestine, because the normal the right side is actually the intestine part. Okay, the left side is actually the rumen. Okay, and then you just perform the palpation of the femoral. So this is just to show you like the procedures, the injections that is done in small ruminants. Okay, so this is how you do subcutaneous injection. All right, just look for the area whereby should be like a loose skin. You just pinch, make sure that the needle is perpendicular. Okay, make sure that the needle doesn't go through to the skin. So if not, the drugs will be coming out from the skin. So this is just the IM injection. The first or the most preferred way would be at the trapezius muscle. This should always be your choice of area when you perform IM injection, trapezius at the neck area. Okay. This is how to take blood. You have someone to restrain the animal like this. Okay. So you just have to occlude. Okay. Because the jugular vein runs from the base of the ear until here, right? So it should be distended. If you release this thumb here, okay, this is actually a procedure called occlusion, okay? This left hand here. So you have to occlude the nerve, the vein first, insert the needle, and then you just push the blood tube into the needle, and the blood will flow coming into the blood tube, and then you can actually release the occlusion. Okay, so while taking the blood, you don't forget to you don't actually release the occlusion. You just have to occlude the vein. All right. So that is it for the. Do you guys have any questions for the PE in small ruminant?
Doctor,
Yes.
I would like to ask, for cattle physical examination, you said that it is suggestible to start doing PE from the back of the cattle and go front. Is there any reason why?
This
That's
is
all.
just no, this is just for you to have like a proper step by step. That's all, so that you don't actually miss anything else. If you are an experienced clinician, by all means you can, like, perhaps start anywhere you like, but we would like to teach students step by step, so that you can actually you don't actually miss out any important things. Okay. Because you will be having OSCE. I think you're supposed to do OSCE. You're supposed to have OSCE this semester. Okay. But because you don't have face-to-face lectures or practicals, so you don't actually have that proper OSCE. So in OSCE examination, the way that you are being assessed is actually step by step. So that's why we like to teach students like step by step. Okay, so that's why it's very important. I think in equine also, like they have a certain like you always have to start. I'm not really sure. You should always start at the left side maybe. I'm not really sure. Okay, but in Ruminants we would like to teach students such way.
Ah.
So you don't actually miss out certain things.
Okay, that's all. Thank you.
Any okay. Anything else?
Hi,
I
doctor.
have question.
Oh, hi.
Okay.
Yeah. Siapa nak tanya dulu ni? Yeah, go ahead.
Hello, Doctor. Saya tanya dulu lah.
Okay.
Doctor, I have question like
Siapa tu?
kan Ama.
Okay.
Okay, Doctor. Kan Doctor cakap like for the parasite, nak tengok parasite infestation kan, tengok on the dorsal side of the ruminants kan. Is there any other side yang macam high risk of getting parasitic infection? Macam ada mites ke?
Oh, okay. You mean ectoparasite?
Yeah.
Okay. All right. Okay. Ectoparasite, I mean, it can affect any areas of skin as long as the skin covers the whole body. So that is actually the location where ectoparasite would like to reside on. Okay. But there are certain, I mean, later on you will actually learn about lice, mites, apa lagi? Ticks. Okay. So all these different types of ectoparasites, they have a preferred site. Okay. Even for mites, we have different species of mites. If you learn in parasitology, you have Sauroptes, you have Sarcoptes, you have apa lagi ya? Coreoptes, for example. So different species of even mites, they have a preferred site whereby they like to infest the animal. Because sometimes in this condition caused by ectoparasite, it would be how to say, it's very prominent. Okay, but you have to check the whole body of the animal. Okay, not only at the dorsum, macam tadi gambar tadi on the lecture slide, it's actually the dorsum, the back of the animal. Sometimes it can actually affect the limbs at the coronet near the apa kita panggil tu? Apa kita panggil? The limbs, the coronet, the coronary band of the limbs. Itu pun boleh jadi juga. Ataupun it can be at the flank area, the inner thigh of the animal is also one of the most preferred site for ectoparasite infestation. What else? Sometimes even face, even the ears, even yeah, it can be anywhere. It can be anywhere. And it's very prominent. You don't, I mean, from afar, you can actually tell that this animal is having like mite infestation, for example, or any ectoparasite infestation. Okay?
Okay,
Okay,
thank you,
tak?
Doctor.
Okay.
Hi, doctor. Why is
Hi.
why is trapezius muscle prefer for IM injection?
Okay, there are several IM injection that can be done in ruminants, okay? Trapezius, and then you can actually do it at the apa kita panggil tu, at the flank area, okay? At the flank, and then the thigh, the semitendinosus muscle, semimembranosus muscle. It is preferred because there isn't any important nerves running through at that area, okay, and it's very muscly. So that's why it is actually the preferred site of injection. I mean, it doesn't mean that you are not allowed to do it anywhere else. It's just that that is the best site. Okay, but in cattle, if you've noticed that we tend to do IM injection at the rump area. Okay, so in cattle pun sama. I mean, if it's it is preferred if you target or if you do it on the trapezius of a cattle rather than at the rump area, because at the rump area they have this very important nerve. Okay, sometimes if you do it wrongly, so you may actually injure the nerve. So once you injure the nerve, then something else is going to happen. So that's why if you were to what do we call, try to minimize any complication. So that's why we choose trapezius muscle. Okay. For example, if you are going to administer, for example, three drugs. So all these three drugs are actually IM injections. Okay. So don't actually do it on the same muscle. For example, you have drug 1 to be administered IM. So you just choose the trapezius on the left side. And then the second drug, you are going to administer it on the right side, trapezius right side. And then the third drug, you can actually use the rump area. Okay, so don't use the same site for a different drugs. One site per drug, or one drug per site. Okay. Anything else?
Okay, thank you, doctor.
Hi, doctor. It's Mira.
Okay. Yes, Mira.
Yeah, I have a question. Like, say, for example, there are certain situations where we can't take the blood from the jugular vein. Can we take blood from other veins?
Yes, you can. Okay, where do you think that other than jugular vein, where else you can actually take? Are you referring to small ruminants or large ruminant?
Both, doctor.
Both. Okay, kalau cattle, where else can you take blood? Where do you think?
Tailhead.
Coccygeal artery. Okay, so meaning at the tail, okay, there's actually a groove in the middle of the tail running through. Okay, so usually you can just like poke the needle into that area. Okay, so that is actually one of the way to collect blood in cattle: coccygeal artery or coccygeal vein, and also this jugular vein. Okay. For small ruminants, okay, of course the easiest would be this one. The jugular vein is very big. It's very easy. Okay, as long as you have another person to restrain like this one here, then it would be okay. The other one is actually the femoral artery. You can actually take blood from the femoral artery. However, it is not recommended because it's very hard for you to restrain the animal on the lateral, on the recumbency. Okay, and then it's such a hassle. So as long as the animal is standing, okay, you have somebody to restrain the neck, the head area. By all means, use this jugular vein. It's very easy.
Okay, thank you so much, Doctor.
Okay. Anything else that you would like to ask? I think I want to show you like the body condition score. Kan, I actually owe you one about this one here. There are many kind of scoring, 1 to 5, 1 to 10. But you should use like 1 to 5. Even like between 1 to 5 pun dia ada like 0.25. Okay, I will show you. This is from Elanco. Basically, it's the same between the dairy and the beef cattle. Although beef cattle they use it like more commonly because it is being produced for apa tu, for meat kan. But for dairy cattle, this is being used to just to make sure that during calving the animal is within the preferred body condition score. Okay, just to make sure that the milk production is good, they don't have any reproductive problems, diseases, they should be able to calve then at the next calving, etc. So it's very important. This one here is for the dairy cattle. Okay. Um, so for example, like this one here, like they even have like 0.25. Okay, 0.25. You don't need to go up to 0.25 or 0.75 even. It's okay if you can just use like 1, 1.5, 2, 2.5, 3, 3.5, 4, 4.5, or even 5. So when you report a body condition score, you should always say that out of what? Because there are different scoring system. They have 10, they have over 5, they have over 10. So you have to tell. If it's 3, 3 out of 10 ke 3 out of 5. So you have to tell over like the scoring tu. Okay, so if you are going to score a body condition in the cattle, okay, usually in cattle lah, okay, so the point of the what do we call that, the this one here, the anatomical areas that is being used is as such. Okay, so from the side of the animal, okay, so these are the ribs. So this area here called as hooks, okay, the bone, the apa kita panggil tu, I think the other name is actually the wing of ilium. Okay, so they call it as hooks. They have pin head here, okay, the pins, and then in between the pins and the hooks they have tail in the middle here. Okay, and then they have tail head at the back of the animal. They have tail head here, just at the starting point of the tail. Okay, so these are all the terminologies which can be used. I think you should be able to use it regularly. Okay, this is actually like a layman punya term juga lah, like all this that meat producers and everything, they use this kind of terminologies. Okay, so they have hooks, they have tail, they have pins, they have tail head. Okay, this is the short ribs. They also have like the additional terminologies, short ribs, and then the sacral ligament, and then the tail head ligament. Okay, so this is actually the point where you should be able to assess the body condition in order for you to determine the body condition score of a cattle. Okay, so for example, I'm just going to show you here. Katalah sini okay, so from the side of the animal, so this is actually the hook and the pins. Okay, so if it's in the V shape, it's either V shape ataupun kita panggil angular shape, or if it's a crescent or U shape. So this one here is like a V shape, so the body condition score would be like a maybe 3. Okay, and then you have to be at the back of the animal to observe. Okay, ni tengok ni, dia punya the shape of the hooks. If it's rounded, it is considered to be 3. If it's a bit angular V shape, it is maybe 2.75. And then you have to look at the pins if it's angular. So they have a different description. Okay, as long as you are able to identify the shape, okay, the anatomical structures, as I mentioned before, you would be able to score the body condition. Okay. This one is I mean, even the ribs would be very visible. Okay, so this would be like around maybe 2. Or if the toe, okay, very prominent, you can actually see here. So maybe the BCS would be less than 2. Okay, so if it's more than 3.25, the shape will be more of the U shape or crescent shape. Like this one here is V shape, kan? 3 if it's less than 3. So if it's more than 3, U shape. So meaning that they have more body fat. This is actually based on the how many body fat reserve, subcutaneous fat in the animal. Okay. And then the sacral ligament tail head is visible if you can actually see it clearly. So perhaps the BCS is around 3.5 maybe. If the sacral ligament visible but you cannot see the tail head ligament, so it is called as 3.5. So this is actually based on the ligament, the tail head, and the pins, the shape of the pins and the hooks. Okay. I've actually included this in your the Google folder. Okay, ataupun there's another way of doing it, like this one here. So this is actually in beef. Okay, so just by looking at the side of the animal, like this one here is very poor. You can actually say as a body condition score 1 out of 5 because you can visibly see the ribs. Okay, so but if it's 2, the backbone, okay, the shoulder bone and hips are visible, but the tail head is slightly recessed. Okay, ribs may be seen, but faintly visible. So you can actually say that this is 2, this is moderate 3. Okay, hip bones are not. You cannot really see the hip bones, the hooks, ribs. You cannot see the ribs. The tail head is not recessed. I mean, it's rounded. Okay, so body outline is smooth. So you can actually say that this cow is 3 out of 5. Okay, this is a bit I mean nak kata over tidak lah, but it's actually more than that, 4 out of 5. So you cannot really see the ribs, the hip bones also you cannot actually see. The tail head is bumpy, meaning more rounded. Okay, and this is fat, considered to be fat, 5 out of 5. Okay, so or you can, yeah, I mean this is more like a straightforward description of body condition scoring. But by Ilanko just now is a bit more specific because they refer to the hooks, the shape of the hooks, the sacral ligaments, etc. Okay, so I've actually put this everything in the Google folder. Anything else that you would like to ask? Anything else? So next week, I hope, should be ready by next week, our video, physical examination in cattle. Yeah, I mean, practice, if you can practice, use your pillows or anything. The act of percussion, the act of ballotment and everything. And I think in our video, we do not include the succussion. So in small ruminants, usually you would do like succussion, whereby you can actually be over the animal. I mean, you can actually be on top of the animal, and then you can just sway the body of the animal, the goat or the sheep, from side to side. So succussion is actually to detect any fluid. So if there is fluid, for example, ascites, for example, so you can actually hear the fluid splashing sound. Okay, so that is not included in our video. Okay, but there's another. I've actually explained that last week, the succussion, one of the diagnostic technique in physical examination. Anything else?
Hello, doctor.
Yes.
My name is Imran. I have a question about ballotment. What would an abnormal finding sound or feel like if you do ballotment?
There shouldn't be. Okay. Sekejap, mana tadi Tengok balik ni lecture note ni. Okay, the act of ballotment, why you are doing ballotment is actually to detect consistency. Okay, tengok balik ni. Consistency. So what are the different consistency that you should be looking at? Ni, this one here. Whether it's doughy, whether it's firm, whether it's hard, fluctuating, tense, and pixelators. Okay, so when you report consistency, so this is palpation, meaning that you still use your hands, you palpate. Ballotment pun sama, because ballotment is actually usually done on the left side of the abdomen. So you usually do ballotment of the rumen. So okay, I would like to ask you, rumen, they have a 3 different compartment. Okay, so what is being filled at the upper part of the rumen?
Gas.
Okay, gas. The second part, apa? Sepatutnya. And then the lower part, what usually what do we have usually at the lower part of the rumen?
The feet.
Usually will be the feet kan, okay? So in between the gas and the feet will be like macam it's not really a feet because it should be like apa kita panggil tu, because rumen is actually a big compartment, so it will be like a by gravity. So usually the middle part tu dia a mixture. Okay, usually not a compacted feet lah. Yang feet tu memang betul-betul dekat bawah at the lower part of the rumen. So when you do ballotment, the upper, you will notice a difference because the upper part usually contains gas. You will notice a difference. So very gassy, kind of like empty when you do ballotment. And then at the middle part, usually it will be feel as doughy in consistency. Okay, doughy if you bake, if you know, you apa kita panggil tu, the doughy consistency of your anything that you would like to bake. So that is how it should be felt like. Okay, and then the lowest part would be thick. So it will be a bit firm at the lowest part. All right. So in the case of bloat, for example, so it can be either gas, bloat. It can either be gas or fluid. So if it's bloat, you can actually feel the same consistency between these 3 compartments, which is usually filled with gas. Okay, kalau normal, it should be atas tu gassy, the middle part doughy, and then the lower part would be a bit firm. Not as firm as like a liver, because if you were to define firm, it's actually like it should be felt as liver. Bukanlah macam tu, but itulah. I mean, too bad because you don't have a practical face-to-face session, because by all means, if you have face-to-face practical, you will be able to feel the difference of doing the ballotment of the rumen. Okay, I hope I answered your question, Imran.
Yes, thank you, doctor.
Okay, anything else? Please ask if you have anything, because yeah, I hope I can actually help you as much as I can. But you have to help yourself as well. Okay, there's a question in the chat. You can also ask in the chat box. Asrina, what would be the best BCS for beef cattle? 3 out of 5 or 5? Okay. The best would be around like 3 to 4. 5 would be considered as very fat or obese, so you don't want that. But beef cattle, I mean, if the animal is too fat, then you would have other problems. Okay, although it is meant for meat production, the beef cattle, but usually you would not go up to like 5 out of 5. Like 4 would be okay, or 4.5 out of 5. Okay, and of course 5 out of 5 is actually considered to be obese lah. Okay, considered to be obese. But I think our producer, local producers for beef cattle, they would also always prefer to have a very obese cattle with a good like 5 out of 5 body condition score. Yeah, but usually if you have like a too fat animal, then you would have another problems, which is also not good. Okay. All right. Anything else?
Hello,
Yes.
my name is Hakim, and I want to ask that does the body condition score change for a pregnant cattle?
Okay. If an animal is pregnant, macam mana? Because it is expected for the pregnant animal to be a bit, it should be bigger in terms of size. So normally you would not need to score a body condition in a pregnant animal. Okay, selalunya tak lah. So usually the BCS would be for the non-pregnant animals.
Alright,
Tak,
thank
dia
you,
takkan
doctor.
okay, because dia takkan tell you lah, because you cannot see, you cannot say that pregnant animal should be the same as the non-pregnant animal.
Faham?
Okay,
Alright.
right. Anything else? Anything else? No. Tak ada eh? Everything's clear? From the previous lecture, ada soalan? Percussion, development. Okay, and again, I hope you guys don't confuse, because this is always the problem. I'm not really sure why you guys confuse. Development is development. And students tend to confuse, like they would say percussion. They don't actually know the difference between percussion and auscultation, or even percussion only. Percussion is percussion, but this one here is actually this one here is an act of two different techniques, which is done concurrently. So that's why it's called percussion auscultation. Kalau percussion je lah. Percussion, you just use your fingers and flick. Okay, you hear it using your ears. You don't actually use your stethoscope. But if you use your stethoscope, it is called as auscultation and percussion. Auscultation because you use. Ingat je, auscultation because you use your stethoscope. Percussion, you just flick your fingers and you hear it with your ears. You don't use stethoscope. Okay. Percussion in ruminant species is not commonly done, but it should be. I mean, you should know. You should know how to do it. Okay, it's not normally being done because ruminants, they tend to be bigger in size. So if you percussion ni, if I think the best is being done on kids, human kids, okay, bukan kids anak kambing, kids, children. So if you notice that kalau pergi klinik tu, kalau macam budak tu batuk ke apa ke, so doktor will percuss. So because they have a thinner thoracic wall, so if they percuss, they should be able to hear it clearly, the thorax, okay, percuss. But in ruminants, usually not so much being done, only percussion. But percussion and auscultation is commonly done. Okay, auscultation, use your stethoscope. This one to percussion. Okay. Hari tu lupa nak record percussion. Palpation. Okay. So this one. So this one here is very important. Okay. The techniques being used. Okay, and don't forget to look at the limbs, mammary gland, the genitalia of the animal. What else? Skin. Okay. Yeah. Okay. If you guys don't have any questions, tak ada, betul? Tak ada ni? Tak ada eh? Okay. You have to refer to this Google Drive, which I have shared. If you prefer to use your own Gmail account, by all means boleh. Nanti I'll just approve. Lecture notes semua dekat situ. I'm not really sure if I still need to upload in Putra Blast, or do you guys prefer to use this Google Drive? Macam mana? You still need me to upload anything on the Putra Blast?
Ikut doktor. If you're comfortable with the drive, you can just use the drive, doctor.
I'm okay. I'm okay with Google Drive or even in Putra Blast. Tapi you guys lah, if you have trouble accessing the Google Drive, then aku just upload. Sebab I cannot upload the lecture video on Putra Plus because they have a limitation in terms of the size of the video. If you're okay with Google Drive, then okay lah. Kiranya tak ni lah. Or maybe you can just upload the lecture notes dekat Putra Plus. Okay, but everything else is in this apa namanya tu? Google Drive. Okay, so if you don't have any questions, Merry Christmas to those celebrating Christmas. Itulah tak cuti pun kan. Dah habis mid-sem break. Okay. If there's no questions, so thank you very much guys. I will upload this lecture video, recorded video later. So siapa yang malas nak dengar ke, siapa yang tak boleh nak dengar ke, can actually listen later. Yeah. I guess that's it. Thank you very much guys.
Thank you, Doctor.
Thank you, Doctor.
Thank you, doctor. Have a nice day.
Thank you so much.
Thank you, Doctor.
Thank you, doctor. Okay, thank you.
Thank you, Doctor.